Socana, prevention by delay. At Socana Brain Institute, we practice prevention by delay for dementia and Alzheimer's-related diseases. Under the direction of Dr. Vinod Bhatnagar, we use the most state-of-the-art diagnostic imaging procedures and the most advanced treatment options available.
My name is Dr. Vinod Bhatnagar. For the last 20 years, I have been evaluating and treating patients with mild cognitive impairment and all types of dementia, including Alzheimer's disease. Through all my time spent in research and experience, I have found that time lost is brain lost.
I started feeling I had a problem about 9 years ago. So I mentioned it to my friend because he was having the same problems, and he recommended that I go see Dr. Bhatnagar. A very good recommendation. Both he and his wife were doctors, so I immediately made my appointment because I figured they knew what they were talking about. So I found Dr. Bhatnagar to be very kind, compassionate, and easy to talk to. He told me he believed in early intervention. That was very important to him. And I found him to be proactive and actually holistic in his approach. So he ordered a bunch of tests because first he had to find out if I had a problem. One of the tests was a PET scan. I've been with Dr. B now for 8 years. I don't feel I've regressed. My latest PET scan actually shows some improvement. But I don't need a PET scan to tell me that I've improved. I know it. I can feel it. And I have Dr. B to thank for that. I really, really appreciate all he's done for me. He's given me back my life. I am better. I know I'm better. And I hope that everyone will take advantage and have the same benefits. I wish you lots of luck.
I became very concerned about my loss in memory several years ago. And as my memory worsened, I started to look for some way to deal with it, to see if I could improve it or at least slow down the rate of memory loss. And my mother-in-law had been a patient of Dr. Bhatnagar's, and I decided to become a patient of his also to try to address those issues. And I really liked his approach because my background is in technical scientific field. And he is really on top of the scientific literature around dementia and treatment programs and new treatments that are being experimented with. And so I've been very, very pleased with his approach, where he's very willing to change what he's doing, modify what he's doing, coming up with new things to try. And I've been very, very happy with the way things have gone. I've been getting IR treatments now for about 3 years. I've also been following his recommendations for brain stimulation exercises. And, you know, quite frankly, I can't tell you where my memory would be if I hadn't been doing this, but I feel very, very confident that I'm much, much better off having gone through all this treatment with him.